Welcome to Module 1, PowerPoint and Audio, Overview of Mental Health and Substance Use, Week 9, Mental Health, Ali Ahmed and Gagandeep Verdi. Objectives: 1. Understanding the linkage between mental health and substance use. 2. Describing the mental health and substance use problem in Canada. 3. What policies, practices are implemented for mental health and substance use in Canada. 4. To see if evidence-based research was used to inform those policies for mental health and substance use. 5. What are the strengths and weaknesses of those policies for mental health and substance use? Number 6. Future research is needed for mental health and substance use. This is Robin Williams. There'd be those nights when you do cocaine and you'd be like, I'm gonna die, I'm gonna die, I'm gonna die, he said in one of his interviews. And then you'd wake up the next morning, I didn't die, let's try it again. The little voice saying, you are garbage, you are nothing, you hear me, yeah, he's still there, believe me. This is Robin Williams. Mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. This is from the Canadian Mental Health Association. What are mental health problems? Mental health, when a person has the strength, resiliency, and attachment to respond to daily stresses and challenges. Mental health problem, when stresses at school, home, work, or in the community tax a person's ability to cope. Mental illness, when mental health problems persistently impair a person's ability to function at home, at school, or in the community. What are mental health problems? Substance use is that use of a substance that is not aligned with the legal or medical guidelines and is usually harmful to oneself or others. There are 10 different classes of drugs. 1. Alcohol. 2. Caffeine. 3. Cannabis. 4. Hallucinogens. 5. Inhalants. 6. Opioids. 7. Sedatives. 8. Stimulants. 9. Tobacco. 10. Other or unknown substances. Substance use is that effects of substance use: constant activation of brain reward system, increased chance of normal activities neglected, association between substance use and people with lower self-control, negative effects on health, economic, and social outcomes, increased risk of developing psychiatric disorders. Estimated between 1/3 and 1/2 of individuals that have some type of mental health condition also have a substance use problem. Effects of substance. What are substance use, abuse, and dependence? Use: any use of psychoactive substances, drugs that affect a person's state of mind. Abuse: when substance use results in problems at home, at school, or in the community. Dependence and addiction: a pattern of substance use that causes severe distress or impairment. What are DMS-5 criteria for substance use disorder? A. One or more abuse criteria within the 12-month period and no dependence diagnosis applicable to all substances except nicotine, for which DSM-4 abuse criteria were not given. B. 3 or more dependence criteria within a 12-month period. C. 2 or more substance use disorder criteria within a 12-month period. D. Withdrawal not included for cannabis, inhalant, and hallucinogen disorders in DSM-4, cannabis withdrawal added in DSM-5. Substance use in Canada. There has been an increased use of Canadians using illegal drugs in 2017 compared to 2015. Illegal drugs include cocaine, ecstasy, heroin, hallucinogens, and speed. 21% of Canadians aged 15 plus exceeded alcohol guidelines for chronic effects and 15% exceeded guidelines for acute effects. 3% of youth aged 15 to 19 smoke daily, 9% of young adults aged 20 to 24 smoke daily, and 12% of adults 25 plus smoke daily. Opioid pain relievers were the most used psychoactive pharmaceutical at 12%, and those 100,000 had problematical use. Substance use in What is the goal? To use a harm reduction method. Some use is inevitable, but we want to lower risk of adverse events and focus on the social determinants of health that are in play. Policies and practices. What policies and practices are in place in Canada to address substance use and using a harm reduction lens? Policies and practices discussed will include Controlled Drugs and Substances Act, regulation of alcohol and tobacco, federal substance use treatment programs for First Nations, Inuit, and other federal client groups, and the Narcotics Safety and Awareness Act. Policy Controlled Drugs and Substances Act came into place in June 20th, 1996. The policy looks at the regulation of psychoactive substances and their precursors except for alcohol and tobacco. The substances can cause disruption of mental processes and cause harm to society. It has 8 different categories where the drugs are classified. It notes that some substances can have medical or scientific benefits, but the goal is to maintain public safety. To maintain public safety, the policy looks to stop or limit trafficking, possessions, and production of these harmful substances when they are given to the public use and not regulated, which falls in line with the United Nations guidelines. Bill C-37, bill passed on February 15, 2017, allows for more supervised consumption sites and community consultation, the manufacturing of machines that are used for pill presses and encapsulates are prohibited, allows for the opening of mails across the border for weight 30 grams or less because of possible illicit drugs being passed by. Government and law enforcement greater flexibility by allowing temporary scheduling and controlled substances and faster disposition of substances. Bill C-45. Bill passed on October 17, 2018. Cannabis is listed Schedule 2 for substances in the CDSA. Allows for possession of cannabis less than 30 grams and 4 plants per residence. Doesn't allow for sale to younger individuals. Ministers in designated areas can issue license permits for cannabis-related activities. Bill There is a belief that having increased drug law enforcement will result in lower violence and reduce the use of the number of illicit drugs. This is parallel to the thinking of that Controlled Drugs and Substance Act. In this systematic review by Warb et al., it had the opposite effect in lowering violence and number of illicit drugs. The focus on increasing law enforcement drug interventions is prioritized over treatment or preventative treatments. There is a belief that Our conclusions. This type of evidence suggests that the increased funds given to Controlled Drugs and Substance Act should be at least partially reallocated to primary interventions or interventions where mental health can be treated for substance use. Our conclusion. Regulation of alcohol and tobacco. Number 1, the Food and Drugs Act. It took place in 1985. This is where the federal government allows for the sale, promotion, manufacturing, and labeling of alcohol, and there are no given limits like there are for other substances. Number 2, the Tobacco and Vaping Products Act allows for the sale, promotion, manufacturing, and labeling of tobacco and vaping products in Canada. It took place on May 23, 2018, replacing the Tobacco Act of 1997. The Tobacco Act was implemented in 1997 to address the public health crisis with the amount of people using tobacco products. There were health promotion in schools, media, and especially directed at the younger generation for youth. This was key in reducing the effects of tobacco and, in turn, lower tobacco addiction. The Food and Drugs Act. Despite alcohol being by far the number one substance use, there is still not a limit on the amount of alcohol a person can consume. It is said that 7.2 million Canadians, nearly 24%, would be classified as heavy drinkers. A question that needs to be asked is, why are there limits for other substances and not alcohol? Media exposure, social norms, and increased stress. There were 6 types of interventions in the systematic review that could have possible benefits to a real life setting for alcohol control measures. Number 1, community mobilization. Number 2, multi-component interventions delivered in the drinking environment. Number 3, restricting alcohol advertising. Number 4, restricting on and off premises outlet density. Number 5, police patrols and ignition locks to reduce drink driving. Number 6, increased price and taxation, including minimum unit pricing. Our conclusion. Although there are limitations of the 6 types of interventions, it still gives us insight on where further research should focus on to see how effective it is. The possibility of reducing negative effects of alcohol at the individual and population level makes it important to at least try these interventions in real life settings. Federal substance use treatment programs for First Nations, Inuit, and other federal client groups. It is administered by Health Canada First Nations and Inuit Health Branch. Looks after alcohol, drug abuse programs, and youth solvent abuse programs. Programs focus on prevention, treatment, and recovery. There are a total of 52 residential addiction treatment centers and 550 community-based prevention aftercare programs. Federal substance Indigenous mental health crisis. First Nations people have 3 times higher rate than non-Indigenous populations. Métis has 2 times higher rate, and Inuit has a 9 times higher rate for death by suicide. Government policies to assimilate the Indigenous community into the Canadian way of living has had lasting effects. It has led to the number one challenge by First Nations was drug and alcohol use at 82.6% for on-reserve communities, lower educational achievement, lack of family structure, loss of language and culture, health effects such as diabetes and obesity. Indigenous mental health crisis. First Nations people. Literature by Stewart et al. 2018 found that the use of alcohol, drug use, and the worsened mental health of Indigenous population can be linked to European colonization and the use of residential schools. It has been noted that interventions that focus on cultural activities and community support have the most positive outcomes. This has led to strong community engagement, strong leadership, and program sustainability and development. Another research literature piece by Antonio and Chung Do 2015 noted that there are differences within the Indigenous population, so having culturally tailored programs is the best approach. Substance abuse programs and suicide prevention programs, when culturally tailored, had positive results among the Indigenous population. Our conclusion. The federal substance use program aligns with best evidence research that the program should be culturally tailored to the Indigenous population because it has shown positive results. In order for this, we must build trust with those communities and listen to their stories and experiences, and only then can we start to understand the inequalities that they face. The Narcotic Safety and Awareness Act. It was approved in 2010 and helps ensure that healthcare professionals such as doctors and pharmacists do not overprescribe narcotics and other controlled substances. The goal was to reduce the risk of addiction and death from overprescribing of the Narcotic Safety and Awareness Act. Psychoactive pharmaceutical use. Psychoactive pharmaceutical use is in the top 4 substance use for Canadians in each age group. 17% for 15 to 19 years of age, 21% for 20 to 24 years of age, and 23% for 25 years or older. Opioid pain relievers were the most used psychoactive pharmaceutical, and around 100,000 had problematic use. Opioids sold to healthcare professionals have increased by more than 3,000% since 1980, and in 2016, upwards of 20 million opioid prescriptions made, and is only second to the United States for prescription opioids. This shows us that there is still a huge problem even though there are regulations within the Narcotic Safety and Awareness Act. Psychoactive Literature by Kumar Udin et al. 2013. Having educational programs, tutorials can help health professionals make the right decisions when prescribing. Having a curriculum in undergraduate and graduate programs for proper prescribing increase their ability to precise correctly. There needs to be more emphasis on educating healthcare professionals and increased training. Using a multi-collaborative approach between healthcare professionals can help with safety and overall effectiveness of prescription use. Non-medical professionals are more prone to make errors when subscribing, so there needs to be an emphasis on more education interventions for this population. Literature by Kumar Udin. Our conclusion: having rules and regulations to go with the Narcotic Safety and Awareness Act is not enough. There has to be an increased amount of educational interventions, training to current and future healthcare professionals. Also, using a multi-collaborative approach among healthcare professionals will ensure less error when it comes to prescribing. Lastly, education must continue even when school is ended, especially with non-medical professionals, so they are kept up to date with the most effective and safe way to prescribe. Our conclusion: Future outlook. Number one, we should redistribute some of the funding that is given to law enforcement for drug intervention and give it to primary prevention strategies for mental health and substance abuse, as well as mental health organization. Increased research about the positive effects of redistributing money in Canada will increase odds of provinces and cities implementing this strategy. Number two, there needs to be better research for alcohol interventions and the benefits it could have for society. The ones listed before in the systematic review had limitations, but there were possible benefits. This is an area that needs to be tackled. As mentioned before in the CTADS 2017 survey, alcohol was the most consumed substance, and 24% of Canadians classify as heavy. Future outlook. Number one, we should redistribute some of. Number three, finding appropriate care population health interventions for everyone by gaining knowledge on the past traumatic events of the Indigenous people and how it is still affecting them. Also looking at different communities or individuals that have shown resiliency to the traumatic events and see how they have dealt with it in order to find appropriate supports to mediate these effects. Number three, finding appropriate care. Number four, government needs to look at evidence-based research and increase the amount of training for healthcare professionals when prescribing pharmaceutical drugs. Special attention should be made to those graduating with a non-medical degree and people that graduated a long time ago. There should be also a multi-collaborative approach to increase safety and effectiveness. Number five, increase the amount of substance abuse policies in the Canadian workplace. There is a lack of information. Only about 35 out of 800 workplaces that were reviewed in the study had policies. There are concerns about privacy and shaming a person with disabilities. We believe the pros outweigh the cons, and this is something future research and policymakers should investigate.